Hey everybody. So this is our review for the course module number one. Um, Hopefully you had an opportunity to review the syllabus and assignment review already. So we're going to take a look at some of the presentations that are posted under course module number one, and then we'll talk about the assignments that are going to be due for this week. All right, so this first one, public health and epidemiology. Um, let's take a look at this one first. All right, so public health, it's the art and science of disease prevention. Um, what really intrigued me about public health is that this is really a population medicine. It's a population-based approach to health. It's trying to prevent disease in a very large group of people. So it's not just understanding the physiology and the biology of disease, but understanding the root cause, the factors that can determine or create disease or health states. So the relationship between public health and clinical medicine, um, the whole purpose of public health is to help people avoid needing clinical medicine. So public health, water sanitization, waste disposal, vaccination programs, nutrition programs, things like that. And again, the primary goal of public health is to understand why people end up going to the doctor or the hospital, and hopefully try and cut back on some of those doctor's visits. So that number's a little bit outdated. I think we're up to about $2.9 trillion in the U.S. alone, and that's just on conventional medicine. Another 60 billion, I think, or 70 billion on alternative medicine. So we're spending a lot of money treating people for disease, and a lot of these diseases are preventable. So when public health is successful, we bypass clinical medicine and people stay healthy. When public health fails, for a variety of reasons, lack of public health measures, lack of access to care, healthcare disparities, sometimes people just aren't interested in being healthy. They either end up going to the doctor and getting treatment, or they end up, unfortunately, getting very sick. So what is epidemiology? It's the study of the occurrence and distribution of disease in specific populations. And again, what we're looking for is the ideology, the underlying root cause of those diseases. So that's really what epidemiology is all about. Some of the textbook talks about the historical contributions and modern uses. I would strongly recommend The Story of John Snow. It's really kind of a cool study, or excuse me, a cool example of the first epidemiological study. So check that one out. So descriptive epidemiology, this is the first step in an epidemiological study, and this is what we're going to be talking about for the first, I don't know, 4 or 5 weeks in this course. And it's basic data collection, essentially. What are people dying from? What are people getting sick from? How many people are dying? What is the mortality rates within a given population? What are the morbidity rates? Morbidity, again, it's just a fancy word for illness. The prevalence rates of these diseases. First, next week, we're going to talk about incidence and prevalence rates for calculating those rates out for different diseases. Then we get into, mortality rates, the distribution of disease, try and determine the risk factors for these diseases. So it's data collection, and it's a lot of mathematics. But for those of you that are stressed out about math, don't worry too much about it. We'll get you through it. Second half of the semester is when we get into the analytical epidemiology, the different types of study designs. All different types. We'll talk in more detail about these. There's some information on another presentation that gets a little bit more information for these types of studies. Case studies, cross-sectional studies, cohort studies, case control studies. Then, of course, the gold standard of medical research, the randomized, double-blinded, placebo-controlled clinical trials. And I have videos that explain all of these different types of studies. I'll have those posted as well. I spend a lot of time in my undergraduate course talking about lifestyle determinants. So I don't spend too much time on this. I know that all of you, being where you are probably very familiar with this already. The CDC estimates that about 75% of our healthcare dollars are spent on treating chronic diseases, cardiovascular disease, cancer, type 2 diabetes, respiratory infections, and somewhere between 80 to 90% of those diseases are preventable if you uh, modify one of the four risk factors: poor diet, lack of physical activity, smoking, and excessive alcohol consumption. So if we were to eliminate, poor diet, lack of exercise, tobacco, and alcohol, we'd probably cut back our spending on healthcare by, I don't know, 70%, something like that. So those are really the main concerns. Of course, there's always environmental determinants. Climate change, air pollution, things like that could potentially cause issues, and then inequalities in health the United States, we are the richest country or one of the richest countries in the world. I guess we are the richest country in the world. We have the most expensive healthcare system in the world. We spend almost twice as much on healthcare than any other country in the world, and yet we rank 27th in life expectancy. The World Health Organization ranked the world's healthcare systems, and they ranked the U.S. at, I think it was 37th, something like that. And it's all due to inequalities in health. Not everybody has access to healthcare in this country. It's kind of unfortunate. I don't get too much into this health psychology, but a lot of the things that we just talked about, these lifestyle determinants, getting people to quit tobacco or quit alcohol, a lot of that comes under health psychology. Understanding why people adopt certain behaviors and then trying to get them to quit those behaviors. So stress reduction, weight management, smoking cessation programs, these are all part of public health. And then, of course, health education, evidence-based information offered to the general public to help try and prevent disease can be a big, important part of public health and epidemiology. So this is pretty cool. This is the innovation adoption curve. So we're going to see this again a little bit later in the semester, but this is how a new innovation is adopted. This is the curve that's followed. So at the very beginning, you have the innovators that adopt it, then the early adopters, the early majority, the late majority, and finally the laggards will adopt it. So a good example of this is the internet. When I did my undergraduate degree at St. Joe's, I started in 1998 and finished. I did it at night while I was working full time, so I finished in 2004, I think it was. 1998, a couple people in my class were talking about the internet and using it for homework. Those were the innovators. By the time I graduated and went to graduate school in 2004, everyone was using the internet. I didn't know anybody that wasn't using the internet. So there were probably a couple laggards that were still, going to the library and looking up books, through the card catalog. Some of you that are younger probably don't even know what a card catalog is, but that's how we used to do it before the internet. All right, so now everybody uses the internet. So that was a very quick innovation adoption. There are other innovation adoptions that are not so quick. The flu vaccine is a good example. Flu vaccine has actually been around for quite a while. Late 1980s is really when it started to get popular. Still, we're only in the early majority phase. Less than 50% of the population used the flu vaccine this year. So, variety of reasons for that. Some people can't afford it. Some people don't have access to health care. Some people are mistrustful of vaccines. Some people just don't think the flu vaccine is very necessary. There's a variety of reasons why something may or may not get adopted. Mammograms would be another one. Mammograms, the innovators were people that were using them. They were not covered by insurance when they first came out. So it took a little bit, it took some time before, now we're probably in the late majority stage. Still a lot of women that don't get mammograms for a variety of reasons. There's a question on your test about this for this week. It's, identify an innovation and just discuss how that innovation was adopted and approximately what point on this curve are we now with that health innovation, and just try and come up with approximate dates for whatever your health innovation is, whether it's some type of a vaccine or some type of a screening program, whatever it might be. Okay, so that was that presentation I wanted to take a look at. There's one more presentation. I'm not going to go through this whole thing. I'll talk briefly about it, but this is another one that's, this one was actually put together by my predecessor, who is no longer at St. Joe's. So again, I'm not going to go through this whole thing. I'll just kind of go through it briefly. You can use this for your test, to help you out with your test. again, just there's a lot of uh, information here that's we just covered in the other presentation. So this was, I think this is from the CDC, the 10 great public health achievements in the U.S. Vaccination, obviously. Motor vehicle safety has improved significantly. We have much safer workplaces, control of infectious disease. In 1900, the main cause of death was infectious disease. By 1960 or so, we had pretty much gotten infectious disease under control. It does seem to be making a resurgence, and there's some reasons for that. But now we extended the life expectancy by like I forget 20 or 30 years, and now we die from things like cardiovascular disease and cancer, which are more related to lifestyle choices and old age. So we have been doing a pretty good job with heart disease, but it's still the #1 killer in the world. Safer, healthier foods. I guess that's a little bit debatable. Depends what type of food you're choosing to eat. We've done a lot of great work with keeping mothers and babies healthier. Um, Fluoridation of public water. That's a little controversial. Harvard just did a study that's found that children that drink water that's been fluoridated actually have lower IQs. So there's some concern that fluoride is a neurotoxin, not necessarily in toothpaste, but in the drinking water. So there's some concern about that. Tobacco, 1950, almost half the population in the U.S. smoked. Now we're down to below 20%. So we've had some pretty good success with different things. Again, just some different explanations about epidemiology, some pretty cool cases of epidemiology here. Again, I'm not going to read through all these. There's one for those of us that are in Philadelphia, Legionnaire's disease. It was actually from the American Legion Convention that happened, and a disease broke out, respiratory disease broke out. So this is kind of an interesting epidemiology case. And I think that's, again, these are just some keywords that I would ask you to take a look at. And they go into the different types of studies. This is what I wanted to take a look at. There's a question on the test about these charts. And you're going to see a lot of these types of charts when you're looking at the epidemiology research studies as well. So this is injuries by tractors, injuries from tractors in 1971 to 1981 in Georgia. And you can see that the deaths actually peaked in the spring and the fall. So that kind of makes sense because that's when they're going to be using the tractor. They have to plow the fields in the beginning, in the spring, and then in the fall they're probably doing harvest. So that kind of makes sense that they peak at that time because that's when they're being used the most. Deaths associated with tractor injuries by time of day. And I've seen a lot of these. I worked in industry for a long time, so I saw not necessarily deaths, but mistakes, human error that happened right before lunchtime and right at the end of the day because people are getting hungry and they start to lose concentration, and at the end of the day they're just tired. We saw similar trends when people work night shift as well. People just aren't used to working at night. So there's a question on the test about these two charts that we're taking a look at here. And this is just another one. Disease and illness and deaths at some point sometimes tend to cluster in certain parts of the country or certain parts of the state, depending on what population you're looking at. And you can see in this one, the deaths seem to cluster in the kind of the northwest region of the state, and which kind of makes sense because that part has a lot more hills, it's a lot more mountainous. So the other parts of the state are much flatter. So that kind of makes sense. And then this just goes into the different types of studies. And again, we're going to give some. It'd be a good idea to read through these, but we're going to give. I'm going to post some videos that give some good examples of all these. We really don't need to get into these right now. We're going to cover these more in the second half of the semester. But it would be good to check out some of these terms here when we talk about disease transmission, the difference between epidemic, pandemic, endemic. Those are all good things to know for this test. probably a good idea to talk. We're going to talk more about the host and the agent next week. Okay, and the environment, of course. So that was that, and then there's another another file here. These are just terms. Use this sheet as a reference guide. I don't know, maybe you want to print it out, or if you come across a term that you're not sure of at some point in the semester, this is kind of a good reference point. So again, epidemic, pandemic, endemic diseases, incidence rates, the different types of studies are on here. So this is a good kind of a reference tool for you to use. And it would probably help out on week 1 number test. Excuse me, the week 1 test. All right, so again, discussion posts this week. Just give an introduction about yourself, where you live, what you do for a living, when you think you're going to graduate, and what you're going to do after you graduate. How is this degree going to help you? And then read and respond to at least 3 of your peers' posts. The homework assignment for this week: watch this movie, U.S. Healthcare: The Good News. It's kind of a cool movie. They focus a lot on Colorado because they've done Grand Junction, I think it is, in Colorado, did a really great job of making sure that everyone in the state or in that city has access to healthcare. So it's kind of an interesting perspective on healthcare. It's about an hour long, and then there's right under that, you see the U.S. Healthcare: The Good News assignment. There's just, 5 or 6 questions on there. So answer those questions as you're watching that movie. And then week 1 number test is posted there as well. So week 1 test is just basically definitions. That's it. No mathematics on this one. Okay? So that's it for this course material. And of course, Wednesday night at 8 o'clock, we will be doing our Collaborate session. Okay? Hope this was helpful.